Head Start is a wonderful program that's been around for over 50 years. We serve children and their families in a very comprehensive way. We want to ensure that children are ready for kindergarten, but there's a lot of barriers that we have to get through when we're serving these families. Mid-America Head Start serves about 2,500 children in Jackson, Clay, and Platte counties. We serve children that are ages 0 through 5.
Head Start looks at that holistic view. So we're not only talking about education, but we're also talking about that whole child that's healthy. So we want the child to be healthy from head to toe. So that's the brain, the teeth, the body, all of that. In addition to that, we do a lot of referrals and follow-up with the families. Unfortunately, with transportation barriers and Medicaid barriers, a lot of times those appointments are difficult to not only make, but keep.
Many of our parents struggle with transportation or getting the time to get off work to meet the needs of their family. And so we are really trying to figure out how we can identify a dental home for our families, but also if that is a challenge to getting the initial assessment, to find ways to bring the dental services to them.
You know, with Medicaid appointments, things like that, they know you got Medicaid, they'll push you out 3 months, 6 months, or you got to do a walk-in, you can sit there for 3 or 4 hours, and I have to work, so I can't do that. So it was always like a catch and chase thing. I would have to see if I can get an appointment. If I couldn't, wait a couple weeks, call back and see if somebody canceled their appointment, just things like that.
Trying to find someone who accepts my Medicaid, and then I found someone who accepted my Medicaid, and then they stopped accepting the Medicaid that I had and dropped that one, so then I had to find another provider who would accept the kids' form of Medicaid as far as their dental. We had to like start all over, so start back going, like getting their teeth cleaned and like all the process they do before they determine what it is, even though we already had all that done.
It's hard to find a dentist that will see all 3 children at the same time. They always want to do it one at a time on different days, and it just doesn't work because I have to take off work every time.
I would say on average, probably about half of our pre-K kids here have cavities that either have been treated or parents are waiting on treatment.
Currently in the Family Conservancy alone, with our delegate, we have 30% of our children who need some type of dental care, and we're having a hard time finding providers that will take their insurance. And so that's the gap that we're looking at trying to lessen.
She gave me the list like 5 months ago. I'm still waiting for an appointment. They had a clinic way out south, but it didn't go with my schedule. I couldn't catch the bus way out there after work, and the bus to my house runs. It stops running at a certain time, so I'm still kind of waiting for an appointment. But I got like some ibuprofen or something to help with the pain, but it's still like a problem because he still has his cavity.
My son had to get a spacer put in, which took me like a year. I knew for a year that it needed to be done, but it took me a year to get it done, which by the time they ended up getting it done kind of made it worser than what it probably could have been if it would have took me like maybe a month or 2.
And it took 3 months to get through the appointment, and by that time he had another cavity that they had to deal with at the same time.
Our health manager works very collaboratively with Mid-America Head Start in identifying community health needs, but in addition to that, she's also meeting with providers such as Samuel Rogers to identify ways to bring dental services to our programs.
If you just think about it as an adult, if you've ever had a dental issue and the pain that you're in, and you're a child that's under the age of 5 and can't really articulate what's going on, think about that distraction and how that would hinder you from doing your daily job, and that's what's happening to our children.
I think it'd be great if providers were more open to taking Medicaid, were more willing to be flexible with hours, have maybe evening hours or weekend clinic once a month. You know, our families are really wanting the care and they're needing it. It's just hard for them to access.